So in paper 4, we'll look at 20 MCQs on vitamins and nucleic acid chemistry. Question 1 says, a 40-year-old man with a 20-year history of alcohol abuse is brought to the hospital by his friends because he was difficult to rouse. He ate a large meal several hours ago. He is emaciated and lethargic. Examination shows severely restricted horizontal eye movement and ataxia on both extremities. The most likely cause of this findings is deficiency of the following nutrients. Since he's a chronic alcoholic, his brush borders of the intestine, this is the brush borders of the intestine, they've been damaged. That absorption of thiamine in particular is impaired. So usually chronic alcoholics will have vitamin B1 deficiency, and vitamin B1 is necessary for enzymes such as pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase, and also transketolase. These enzymes require thiamine as a coenzyme. These two need them as a group. We call them tender loving care for Nengi. That's thiamine pyrophosphate, lipoic acid, coenzyme A, FAD, and NAD. That's flavin and niacin. That's tender loving care for Nengi. So if thiamine is not present, these enzymes will not also work. This one requires majorly just thiamine as the coenzyme form. So if in chronic alcoholics, thiamine will be deficient, this enzyme wouldn't work, leading to the several symptomatic manifestations of this patient. So option C will be the correct answer. Question 2 says, a 27-year-old woman with epilepsy. I told you guys that the difference between seizure and epilepsy is that epilepsy is just a case of recurrent seizures. Has been taking phenytoin to control her seizures. She is now pregnant and her physician is considering changing her medication to prevent potential bleeding episodes in the infant. What biochemical activity might be deficient in the infant if her medication is continued? Now, phenytoin inhibits gamma carboxylation in the liver. The reaction of gamma carboxylation in the liver that is vitamin K dependent for the clotting factors 2, 7, 9, and 10. So if phenytoin is given, gamma carboxylation of these clotting factors is going to be impaired. So we need to change her medication to prevent these things from happening. So it says what biochemical activity might be deficient in the infant if her medication is continued. There will not be gamma carboxylation of glutamate, and this will lead to bleeding because these clotting factors will not be synthesized. So the fetus that will be born would bleed. Question 3. A 75-year-old woman is seen in the emergency room with a fractured arm. Physical examination revealed multiple bruises and perifollicular hemorrhages, periodontitis, and painful gums. Her diet consists predominantly of weak coffee, bouillon, rolls, and plain pasta. Lab results indicate mild microcytic anemia. Which of the following enzyme should be less active than normal in the patient? So this patient most likely has vitamin C deficiency. Check her diet. Her diet does not contain any form of intake of vitamin C, and her symptoms are predominantly of what? Vitamin C deficiency. And vitamin C is needed in the production of collagen. Is needed as a coenzyme in the activity of the enzyme called pyrohydroxylase. So this enzyme will not work, collagen cannot be effectively formed, and then we're going to have scurvy and bleeding issues due to vitamin C deficiency. Question 4 says, leukemia patients are often given the compound leucovorin as N5-formyl tetrahydrofolate following treatment with the drug methotrexate. Why is leucovorin useful as part of this treatment protocol? Now, when methotrexate is given, methotrexate, this reaction DUMP being converted to DTMP, and the supplier of the methyl group here comes from methyl tetrahydrofolate, handing over the methyl to vitamin B12 actually. So vitamin B12 now hands over the methyl to this reaction, and all this process goes on. So this dihydrofolate, it gets converted to tetrahydrofolate. I'm missing some reactions though. The enzyme that carries out this reaction is called dihydrofolate reductase. Now, we are going to prevent the formation of DTMPs by either acting directly on this reaction here or preventing the process of creating methyl tetrahydrofolate. And we can give a drug here. The drug is called methotrexate. Now, methotrexate would block the activity of this enzyme. So methyl tetrahydrofolate levels will not be available for this reaction to go on. Another drug that we can use is 5-fluorouracil, 5-FU, to block the activity of the enzyme called thymidylate synthase. So it blocks the activity of this enzyme from forming this. But the focus for this question is methotrexate. So if methotrexate is given, all the cells that are rapidly proliferating, even the cancer cells, will be affected. So we are going to give the patient leucovorin, that is N5-formyl THF, which would then go to the normal cells of the patient, not the cancerous cells, the normal cells of the patient, and it's going to be converted to tetrahydrofolate by bypassing this step here, because the folate is given normally, it's going to get to DHF, then to CH3, THF, and all that. So we are going to bypass this. So leucovorin gets given, and formyl tetrahydrofolate can easily get to be converted to this for all these ones to happen to normal cells. So the essence why we are giving leucovorin is it can be converted to tetrahydrofolate by bypassing dihydrofolate reductase enzyme blockage. So question 5, megaloblastic anemia has two most likely causes: deficiency of folate and a deficiency of vitamin B12, that's cobalamin. So this is vitamin B12. Often, treatment of patients with cobalamin deficiency improves in terms of their hematological features with treatment with folate, but not in their neurological symptoms. What is most likely explanation for this? So the truth is that if we give excess folate will blunt the trapping of folate as N5-methyl tetrahydrofolate. So let's go back to the previous slide. So I told you guys that vitamin B12 is so necessary for the process of methylation. It takes the methyl group of methyl tetrahydrofolate. But when we have vitamin B12 deficiency, folate will be trapped in the methyl state, and that concept is called folate trapping. To overcome this folate trapping, I can give more folate. So sort of folate can then, without the help of vitamin C, can relatively still methylate this reaction. So that's really what happens here. So excess folate blunts the trapping of folate as N5-methyl tetrahydrofolate. So question 6. What would be the consequences of a deficiency of vitamin B12 on fatty acid oxidations? Which of the following metabolic intermediates might accumulate? So during fatty acid oxidation, especially for odd-chained fatty acid, so there's going to be formation of propenyl-CoA, and propenyl-CoA will be carboxylated to methyl-malonyl-CoA, which would undergo a mutase reaction to succinyl-CoA. Now, this reaction requires vitamin B12 as a coenzyme. Now, in the absence of vitamin B12, this reaction wouldn't work, and methyl-malonyl-CoA will accumulate in the body and then go forth to become methyl-malonic acid. So it's the acidity created now that damages the myelin sheath, creating a peripheral neuropathy you see in patients with vitamin B12 deficiency. So what will accumulate as an intermediate will actually be methyl-malonyl-CoA. Question 7 says, a 6-year-old boy had meconium ileus at birth. So when he was born, he didn't poo at first. He had now developed chronic productive cough and bulky fat-containing stools this child has cystic fibrosis. And one cardinal sign of cystic fibrosis is that they are going to have steatorrhea. Now, once they have steatorrhea, it means that vitamins A, D, E, and K would be poorly absorbed in the intestine. So the patient can come down with nyctalopia, rickets, vitamin E deficiency symptoms, and bleeding issues, easily bruising due to vitamin K deficiency. So whichever ones you find in the options will be the answer. And there's rickets here, so rickets will be the answer. Question 8. Excessive intake hypervitaminosis of which of the following vitamin is associated with increased risk of congenital malformation? The answer is vitamin A. Question 9 says the neurotransmitter GABA, dopamine, and histamine are all derived from an amino acid precursor. The generation of these neurotransmitters from the appropriate amino acid requires which of the following cofactors? Vitamin B6 will be needed as a cofactor. Burning foot syndrome has been ascribed to deficiency of pantothenic acid. Question 11. The pentose in nucleotides are in beta-furanose form. You could review your carbohydrate metabolism lectures for that. To identify self-DNA from non-self-DNA, self-DNA will be methylated. The backbone of DNA is made up of what? Hydrophilic phosphate groups and the ribose sugar. 14. Which is the most stable form of DNA under physiologic conditions? BDNA is the most stable form of DNA. As far as absorbance of DNA at 260 nanomoles is concerned, which is correct, individual nucleotides will have better absorbance compared to single-stranded compared to double-stranded. So that is correct. Question 19. When we dehydrate DNA samples, it induces the formation of aDNA. So aDNA survives in humid conditions or dehydrated environments. Question 17 says an increase in temperature of DNA sample causes changes in both absorbance and viscosity actually. An increased TM, that's melting point of a double-stranded DNA, may be due to high content of C's and G's. So C's and G's are joined with triple hydrogen bonds, while A's and T's are joined with double hydrogen bonds. So if we have more C's and G's on the DNA strand, the TM will actually be increased compared to A's and T's. So this one will have higher TMs compared to A's and T's. Thymine is present in transfer RNA, ribotymine loop of transfer RNA. Question 20. Which of the following statements is true? DNA is more stable than RNA in alkaline conditions because of the presence of 2'H compared to RNA's 2'OH on the ribose sugar. So that's the answer. So thank you guys. See you guys in paper 5.